Hello, and welcome to the next installment of problem solving the issues that you find in the Pilates studio. So these are questions that I probably get the most commonly from the teachers that I'm training or from the teachers that I'm working with who've been teaching for a while. So if you haven't seen it yet, go back and have a look at that anterior hip pain for people who really get these incredibly tight quads and painful quads when they're doing exercises like leg circles, or have their legs up in the air for doing some of our sort of abdominal series in the mat work. Today we're going to look at neck pain during any forward flexion that we are doing. So we're not looking at somebody who's got osteoporosis or any other conditions here. We're looking at our normal everyday client who doesn't have any significant pathologies. And neck pain in forward flexion is incredibly common. And a lot of people will suffer with that pain and not know that there is something that they can do about it. It is actually not that hard to get rid of neck pain once you understand what the underlying issue is. I think one of the biggest things or biggest problems that we have is the way that we cue that. Because usually when we talk about forward flexion from that supine position, we tell people to lift their heads. And so that's exactly what they do. They lift their heads, but they don't understand that actually the head is supported by the abdominal muscles and that the ribs have to move before the head lifts. Okay, so we're going to have a look at that in a little bit more detail. So lack of rib movement is really going to put a lot of pressure onto the neck. I think the other thing that's really important is that we understand that just because we're lifting the head and the abdominals are shortening, we need to think about what's happening at the back of the body. And if we cue the lengthening at the back of the body, it makes it a lot easier because then it becomes less about lifting the head and more about creating space in the body. So sometimes it helps us to switch that perception that we have of what it is that we're doing from a strengthening to a lengthening movement. And then the other thing that could be an issue is tightness in the jaw and in the face. So if people are complaining about that, I might even start with tension through the jaw and the face first to help them to have more relaxation through here so that it's easier for the head to come up. So I've got the lovely Fleur here with me today to help demonstrate the exercises and all the exercises in this series. So come back every single day as we problem solve this issue. So if you haven't subscribed yet, please hit the subscribe button below. And if you want more information and more help, please look for the link below in the description for the Teach Pilates with Confidence Academy, where there are plenty of different workshops and more workshops being added every single month for you to be able to keep exploring, keep learning, and keep being inspired. So we're going to release the face now. I'm going to get Fleur to think about, let's use the index finger and find the jaw joint. So open and close your mouth and find where that is moving. Now move your finger slightly further forward in front of the joint and then line the other two fingers up in front of that along the edge of the cheekbone. Gently push down into that area and imagine your cheek is a block of clay and you're going to make 3 grooves down to the bottom jaw. Then you're going to pick the fingers up, sink your fingers in and drag back down. So we're going to do about 5 or 6 of these. That is your masseter muscle, and it's a very powerful muscle in your body. When that guy's tight, it can cause your secondary breathing muscles to pull on your upper 2 ribs, so your scalenes, and then that means it's harder for your longer, slower abdominal muscles to be able to move the rib cage. So we want to release tension out of the face. Yeah. And then we're going to do the same thing on the other side. So we're going to find the jaw joint, let the finger sink forward, line up the other 2 in front of it, and then gently drag down and just massaging that muscle. So you don't want to push upwards, we want to drag down because we want to release the tension in that muscle.